Okay, this video is called MOTELS, the approach to dementia prevention. And I'm kind of joking around here in the sense that I was just teasing, to sure as I about not having enough content in the video. So now I'm going to make like a hyper content video. But, all of these things I've made lectures about them before, but it's just a mnemonic. And it's not even the best mnemonic, but it's a decent mnemonic to quickly summarize all of dementia real fast. Mouse equivalent theory of Jack Dietary, that's the best overall one to sort of frame everything. So basically, it's also called the chronic cerebral hypoperfusion theory. He tied off a mouse's carotid artery. Middle-aged and older mice would be demented typically 2 months later. Did an autopsy on them. Instead of seeing a big stroke, they just had apoptosis, atrophy of the brain on the same side. He tied off the carotid. So then you say to yourself, well, what's like that? Not many people have carotid occlusions. Well, tons of people are hypertensive and they are potentially overtreating their hypertension. And when they overtreat that hypertension, drive the pressure down too low, the brain might be underperfused, not getting enough blood. That happens on a chronic basis. You've got chronic cerebral hypoperfusion, and it raises the question, where do you want the threshold for treatment of hypertension? The drug company wants it as low as possible. They sell more drugs, make more money. But is the patient better off with that? Probably not. Okay, mitochondria inhibitors. I just recently gave a lecture on mitochondrial inhibitors and how they decrease the ability of the cell to make energy because the mitochondria is where the energy is made. And the point is it all leads to a final common pathway of apoptosis, which is neuron cell death. When you've got mitochondria inhibitors and when you've also got SERCA inhibitors, sarcoplasm, endoplasmic reticulum, calcium ATPase inhibitors, or when you've got excitotoxins, things causing increased neurotransmitter to go across the synaptic cleft, thus overactivating the postsynaptic neuron, thus causing excessive metabolic activity, metabolic demands for energy in the postsynaptic neuron. So anyways, they all cause a problem for that neuron that ends up being about the same thing. Okay, and the significance of saying that they're all about the same, mitochondria inhibitors, excitotoxins, and SERCA inhibitors, is that they're additive, they're cumulative. So a lot of people have a few of each, and when you add them all up, you're potentially going to get more and more significant effects and be losing brain cells. Okay, all meat and animal foods are bad. They're all basically, think of them as a metabolic poison. Once you realize they're a poison, it's a lot easier to never eat them again for the rest of your life. Watch out for some medications. Some of these medications will cause cognitive effects. Most important one to be aware of is like psychiatric medications. Watch out for them. Almost all of them push the patient in the direction essentially of a chemical lobotomy. Okay, oxidative stress. Excessive iron accumulation begins in men in their 20s and women when they're postmenopausal, can lead to ferrous redox cycling and can accentuate other processes like cause reactivation of dormant bacteria in the blood. And there's a whole cascade of events. And good video on that is the work of Douglas Kell and Etheresia Pretorius. I made videos about that. I think it was called amyloidogenic clotting. They cause abnormal blood clots that are more difficult to dissolve. Problems with omega-6 fats. I made videos about that, especially with regard to Tetsumori Yamashima, the Japanese neuroscientist who figured out why more Japanese were becoming demented than in the past, and it's because of excessive intake of omega-6 cooking oils. Excessive copper, less important than iron, but people can potentially take on too much of that from, copper plumbing pipes or from if they're taking a vitamin that has it in there and they're not aware of it. Oils should be avoided 100%. Oils are just toxic to endothelial lining. They're toxic to the intestinal lining. They're 100% processed, terrible food. All oils are bad, including olive oil. Okay, traumatic brain injury, TBI. I have a couple lectures on that, and also the fact that simultaneously you get increased intestinal permeability, leaky gut. You also get increased blood-brain barrier permeability. So that creates a mechanism whereby if you absorb bacterial toxins, for example, across the abnormal gut wall, they can get into the blood and get into the brain because the brain has increased blood-brain barrier permeability. So it's the point of it is in a person who's post-traumatic brain injury recently or post-stroke as well, a similar process occurs in that setting, they should be real careful about avoiding leaky gut. Okay, toxins in the water, you got to filter your water. At a minimum, your tap water should be filtered with a carbon filter. There's all kinds of toxins in processed food, like neurotoxins in these GMO food sprayed with some of these herbicides and pesticides. One of the things there'll be a tendency sometimes, or if you process soy, you'll put hexane in there. It's a neurotoxin. A lot of these preservatives are SERCA inhibitors. Antifungals are often mitochondrial electron transport inhibitors. And all this stuff adds up. Processed foods can have multiple of these different types of neurotoxic chemicals. Air pollution can be neurotoxic. They think Aluminum is in some of that stuff that's inappropriately coming out of the planes up above the trails. Okay, exercise really helps protect you from dementia. And I think the reason is exercise totally activates the brain. You know, why do humans have brains or animals have brains but plants do not? Because plants don't move. Once you start moving out in the wild, you got to learn your environment real fast. So the brain has to be awake and alert. And then you got to make value judgments. You know, walk towards the fruit, walk away from the coyote. You have to be able to navigate, avoid obstacles. You have to have a memory, remember where you started, how to get back to where you started from. You need the social interaction typically of the other animals of your species, for example. Okay, so that increases BDNF, brain-derived neurotropic growth factor, and causes new synapses to form, synaptogenesis, and can even cause new neurons to form, neurogenesis. Excitotoxins are just toxins that overstimulate neurons to release more neurotransmitters, and that can overactivate the postsynaptic neuron. Leaky gut means increased intestinal permeability, and that can lead to bacteria persisting in one's blood. They're often dormant, like a spore almost. Gram-negative bacteria can produce LPS, lipopolysaccharide. Gram-positive can produce LPA, actually it should be LTA, lipoteichoic acid. When you've got excess iron getting into the blood due to chronic accumulation and sometimes also due to necrosis of cells like liver cells, they can reactivate these bacteria. These bacteria will release LPS and LPA, and that can cause abnormal blood clotting. It has to do with the protein structure. You know, protein structure, secondary configuration changes from alpha helix cylindrical structure into a flat structure like a beta pleated sheet, which can stack up like a bunch of pieces of paper, and those become insoluble, and it's a problem. Okay, low fat, low sodium, whole food, vegan diet, organic only, no oil, no alcohol, and nothing with more than one ingredient. That's the best diet there. Sodium should be avoided. You know, our ancestors ate about 25-to-1 potassium to sodium, and we eat about 10-to-1 sodium to potassium. So we're messed up on terms of that. Most people, if they're eating processed food. Stress management. Yeah, because stress increases, you know, the hormones, cortisol, catecholamines in the body systemically, and in the brain, it increases glutamate transmission across your synapses, including your hippocampus. So it overactivates the postsynaptic neuron. Stimulants, caffeine's bad, double bad, because it increases the same hormones as stress, plus it also vasoconstricts the arteries to the brain by about 15%. MSG is a stimulant. Glyphosate is an excitotoxin, so is glyphosate. Think of it as being like glycine phosphate. So is aspartame. Okay, so any of those things can overactivate neurons. SERCA inhibitors. SERCA means sarcoplasm, endoplasmic reticulum, calcium ATPase. Endoplasmic reticulum is a calcium warehouse in the cell. And if you inhibit that, you inhibit the ability of the cell to pump calcium out of its cytoplasm, which is a problem because high cytoplasm calcium causes increased neurotransmitter release. Okay, you got to get your sleep. Try to go to bed earlier because you tend to wake up at the same time every day. Try to keep on studying or learning in some way, ongoing, every day for the rest of your life. You know, Brian Merzenich, he's kind of a famous guy who did research on cochlear implants and also on cognitive performance. And I think he had some... You know, he was some company, something to do with like brain training games. And he's a pretty bright guy. He's a little bit fat, so I don't know nutrition, but he's pretty smart on this other stuff. And he was asked, you know, how do you get increased performance in the brain? And what you do is, he says, you have to practice every day. So I think that's also part of being smart. You can have a smart personality or a stupid personality. If you want to have a smart personality, be in the habit of reading every day. Try to have at least one friend you can have intellectual conversations with. Be careful how you talk. Pay attention to your vocabulary, that you're not just talking like a typical stupid young person. For example, I've seen that if you have a bunch of men who are between the ages of about 18 to 24, every other word that comes out of their mouth, every sentence, not every other word, but every other sentence is going to have the F word. This effing thing, that effing thing, can you effing believe this? I can't effing believe this. Just do it like this way. You're effing up. That's all they say, nonstop. I've sat there and just observed them and listened to them out of curiosity. Because I lift weights a lot, so I sometimes see young guys at the gym. Okay, now, if you have a couple of teenage girls, they keep saying it's like, you know, it's almost like the Valley Girls. And I'm not talking about Valley Girls. I'm not talking about, you know, San Joaquin Valley, California. I'm just talking about Midwest. Anywhere, teenage girls. It's like, you know, it's like, you know, it's like, you know, it's like, you know. Okay, so if you want to be an intelligent conversationalist and able to speak effectively, you have to pay attention to what you're saying and correct yourself. Don't let yourself be talking that way, and don't be saying and duh so much. If you're aware of it, you'll gradually reduce those tendencies. Social compatibility and being around people. We're sort of made to help each other, so that's part of being, helps you to be psychologically healthy. Spiritual also helps. Nowadays it's taboo because, the Democratic COMMEES are trying to get rid of Christianity. It's sort of like taboo to say Christian, but, the country's always been that since its founding primarily. And religion makes people a lot healthier. Whatever the religion, it doesn't have to be Christianity. Whatever the religion, the people are just healthier. And I think it's because of the word. Like I said, in Latin, it means legare, relegare, to ligate, to tie together the people. It kind of gets them to be working together more with each other, helping each other, and they all end up being better off. I've seen a lot of bad outcomes in people that are atheists. They don't have as much resilience. Okay. Anyways, and then I laugh because Dostoevsky, the writer, Fyodor Dostoevsky, the Russian writer in the 1800s, he would constantly throw that in somewhere in his books. Often it would be a major component of his books, like Brothers Karamazov is a great book. And I have a tendency to do it just because I think that's such a big issue. Anyways, I realized that was a little bit all over the place, but it provides a quick summary, and then MOTELS, so MOTELS is sort of the acronym mnemonic to help you remember it. So anyways, hope that was helpful. That's pretty much of a summary of the scoop on what causes dementia and a little bit of an idea how to avoid it.